Okay, great. We are live.
Fantastic.
So,
Yeah, our as we wait for people to come in, our program in Houston is one of only a couple residential programs in the country for OCD.
oh, okay.
So yeah, so we shut down in March, and we're doing everything telehealth. But there's been a big pressure, a lot of people wanting to come in and trying to find the balance of how do we help people but stay safe. Especially when with OCD you think stereotypically germs and contamination issues, but now we have to wear masks and do hand washing rituals and things around them. So it'll be a lot of fun.
Yeah. So, all right. Well, welcome everyone. For those of you who are tuning in, looks like we have a few dozen people on already. If you know me, I'm Lisa Leitner with A Day in Our Shoes and Don't IEP Alone, although we're not going to be talking about too much IEP specific stuff today. But we are going to be talking about a couple of issues related to our kids, specifically OCD and anxiety. With me today is Dr. Chad Brandt from Houston, Texas. Um, he's a clinical psychologist at the McLean OCD Institute in Houston. Right now, he is doing, they're still on semi-lockdown in Texas too, and he's doing telehealth appointments and runs a clinic there. And why don't you tell us a little bit more about yourself and what you do?
Yes, thank you very much for having me, and thank you everybody that's jumping in. It's a pleasure to be here. So I'm a clinical psychologist in Houston, Texas, and I specialize in treating OCD and anxiety in children, teens, and adults. So I spend a good portion of my day with kids and teens. So all of my training was all rooted in anxiety disorder. And then I hopped around. I did some substance use work for a while. I did some chronic health issue work for a while. And my last, golly, I guess 3 years now has been really focused in on just OCD. So the McLean OCD Institute of Houston, we're one of a handful of residential OCD programs, like I was saying, in the country. So we'll see I'll see like mild and moderate cases of OCD and anxiety, but I'll also see the extreme and the severe cases. So the people that take 16-hour showers, the people that pray on a loop for hours and hours and hours a day, the people that do really complicated rituals to keep family members alive, do and don't touch certain things. All of that stuff is what I do. So the coronavirus has been very interesting in terms of kind of, in a way, kind of confirming, I think, for some people that germs are real and germs are dangerous. But also, it's I think good practice in saying, well, yes, germs are real, pandemics are real, and these are the steps I need to take to stay safe, and this is how I can continue to live my life, even in quarantine, kind of like you're doing now, posting
Right,
videos.
right. So, what would you say? What are some misconceptions or things that parents particularly, don't know about OCD in children, or that
Yes.
we don't know what OCD in general?
Yeah, that's a good question. So about 2% of people have OCD. So that's millions of people in the United States. It's more common than people think. Um, One thing that's interesting about OCD is that I think OCD is very, very commonly misdiagnosed. And oftentimes by the time a kid gets to me, they will have been diagnosed with two or three or four other things. So OCD can look like ADHD in kids sometimes. They might be flighty, they might not remember things, they might look like they're having trouble focusing. It could be ADHD, that could be attention difficulties. It could be that they're doing a mental ritual, that they're having an intrusive thought, which is I can talk about more in a second, but they're having an unwanted thought about germs or about God or about something else inappropriate, and they're doing something in their head to make the thought go away. So that might look like ADHD when it's not. They're just busy thinking. Um, it can look like a Tourette's or a tic disorder. One common way that OCD will show itself in children is a just right feeling. So a kid who has to put his socks on just right and tries over and over and over and over and over until it feels right. We'd call that a just right OCD thing. And sometimes kids will have little like motions that they do, or they do it repeatedly until it feels right. So that looks a lot like a tic. Sometimes it is tics. Sometimes it blends more into the OCD world. Sometimes they can live together too, which gets a little bit messy. But I think that's one of the most common misconceptions about OCD is it can look a lot of different ways. It's not just about germs and about hand washing. It can be about a lot more than that. It can really affect a kid. So I can talk a little bit more actually about what OCD is. I should start there. Um,
Okay.
and then it can differentiate a little further. So obsessive compulsive disorder. The O of OCD stands for obsession. An obsession is an unwanted, usually inappropriate thought that causes anxiety. We could call those intrusive thoughts. Is this dirty? Am I going to kill my mom in the middle of the night, even though I don't want to? What if I offended God? What if I'm a bad person? What if I coughed on somebody in school and they die of coronavirus? Those are all examples of intrusive thoughts. They're normally uncomfortable and unwanted. Um, that's the O of OCD, and then you've got the C of OCD, so the compulsion. That's the thing we do to make the thought go away. So that could be hand washing, right? Oh no, I'm having a thought about germs and getting sick, so I wash my hands. That could be praying. Oh no, I thought I just offended God. I need to ask for forgiveness over and over. That could be doing something until it feels right or until somebody feels safe. So OCD can look a lot of different ways. All intrusive thoughts are normally pretty taboo. They're normally unwanted. They're normally about sex, harm, harm coming to somebody, harm coming to oneself. So kids, a lot of times, if they're having intrusive thoughts, will hide them, will hold them in, because they know the thought isn't like appropriate or good, and they're sometimes afraid to tell somebody about it, and then they'll struggle with it internally. So sometimes kids will hold on to their OCD really close and not tell people, and it'll kind of pop out in some of the ways I was mentioning. So it might look like they're not paying attention when really they're doing a ritual, or it might look like they're having a tic when in reality they're again doing some kind of ritual. So that's some of the ins and outs of how it can be difficult to understand OCD, especially in kids when they have trouble talking about it.
Okay, so when you and I chatted for a couple of minutes before we started this, and I said, I know in my experience that, these things, ADHD rarely travels alone, anxiety rarely travels alone. I mean, so I don't think I know one child who has just one condition. They almost always have something comorbid. So what are some of the common comorbid conditions, and how do you piece that out, and how do you evaluate that it is OCD and not ADHD or anxiety or something else?
Yeah, that's a good question. That's a good question. So some of the things that most commonly come with OCD, there's a family of OCD type disorders. So Tourette's syndrome, your tic disorders, especially in kids, those will run in families. Body dysmorphic disorder, or thinking there's something wrong with your body. Is my nose too big? I got to check my nose. Maybe I need a surgery. Maybe I have to push on it. That would fall under the OCD umbrella. That comes a lot with teenagers, boys and girls. Certainly attention difficulties would come with OCD. If I'm spending so much time thinking about terrible things happening, it's hard to pay attention. You could get a lot of worry, and worry and OCD are different, but you can get a lot of worry. And if a kid goes untreated, or an adult, if anybody goes untreated with OCD for a while, they'll almost always fall into some sort of depression. And they might come out of it and go into it in time. But again, if I'm spending 2 hours a day showering instead of talking to my friends, doing after school activities or whatever, I'm more likely to feel isolated and depressed. So in terms of differentiating OCD from other things, the presence of an intrusive thought, the presence of a thought that usually doesn't make much sense, and the presence of magical thinking is very important when you look at OCD. So that might be a differentiator between worry and OCD. I might worry about getting in a car accident. Just myself, if I were to drive around, that would be a worry. I'm thinking about something in the future that might happen, that is kind of realistic to happen to some degree, and I spend time thinking about it even when I'm not in the car. That would be a worry. OCD would be like an intrusive thought, an obsession about getting in a car accident, and some ritual to keep myself safe. So every time I think about a car accident, I have to tap my left hand 3 times, and that somehow kind of magically keeps everybody safe on the road. So that would be one of the differentiators. And that's what I look for in kids a lot of time. Does the thought come back? Does it make sense? Is it magical?
Okay.
Mm-hmm.
And is there a magic age, or is there an age where you see more cases kind of manifest themselves? Like, is it a tween thing, a puberty thing, older kids? Is
No,
there?
yeah, OCD can come very, very early in the lifespan and can come much later in the lifespan too. So I won't see any kids younger than 5, just because at 5, I can interact with them a little bit. I can give them a handful of tools and the parents more tools to work together. At 3 and 4, no, we're running around, we're doing things. We're not listening to a therapist. But I've had parents bring 2 and 3-year-olds to me, or bring a 5-year-old to me who's had symptoms of OCD since they were 2 or 3, of like taking a baby wipe and touching themselves 3 times across the body, or being able to eat certain foods and not others, and being afraid somebody would die if they ate a watermelon, for instance. So there are some kids that get it really young, and then OCD will sometimes come about during a time of stress. So that would be your transition between elementary and middle, or middle and high school can be a big kind of breaking point where OCD kind of comes through. Puberty, college, childbirth, any kind of traumatic event. Some of these things happen later in life. So people can really develop OCD from early childhood into pretty early adulthood.
Okay. Someone asked, what's the difference between ODD and OCD? And she says, I've been told that OCD can look like ODD, but they are very different.
Yes. Oppositional defiant disorder, ODD, is a child who, well, is defiant to parenting, or to rules, or to structure. So a kid who just won't follow the rules, whatever they might be, wouldn't clean up, wouldn't listen to the parents, some things like that. Normally, a kid with ODD is a little maybe more defiant, is a little more potentially angry, or kind of dismissive of the parent or the authority figure. A kid with OCD is almost always scared. So a kid might not be listening. If I tell my son, hey, buddy, it's time to come inside right now, and he has to go through a doorway to come inside, and he has an OCD concern about doorways, and maybe he thinks if I walk through a doorway in the wrong way, my brother would die. He would be very defiant with me and not wanting to go through the doorway, because he would be very scared. He'd be terrified of hurting someone. And so with OCD, it would take me coming out and saying, okay, what's going on? How are we feeling? How do we handle this? So that's how I might handle an OCD concern. ODD would be a little bit more of, here's the rule, here's the boundaries, here's the consequences. We can follow the rule now and this happens, or we can not follow the rule and this happens. There's usually not fear.
Okay.
Mm-hmm.
Does OCD have anything to do with strep levels?
That's a good question. I'm going to get in trouble by answering. So that's a question about the term PANS or PANDAS.
Right. That's what I figured she was getting at.
Yeah. There is data that strep levels can cause some OCD-like symptoms in kids. There's also some data that that's not the case. So the data out there is kind of messy. There is some data that if you take kids with elevated strep levels and pump them full of antibiotics, their OCD symptoms go down. That is true. That happens sometimes. I've also worked with kids who've had so many different antibiotic regimens with no change to their OCD symptoms. What I can tell you about PANS, and thank you for the question, and thank you everybody for the question. But what I can tell you about PANS is more than half of kids who have a sudden onset of OCD symptoms at a strep infection will maintain OCD symptoms after the strep is gone. So you're likely looking at probably OCD that was built to be there, or maybe that was already there that nobody noticed. And then during this time of stress, the OCD kind of popped out, and they're going to have OCD. They just have OCD. And the strep was just a kind of a natural stress point where it came out. I think if PANS, if it was purely about, the antibiotics and the strep in the brain, you would see 80, 90, 100% of kids get better with antibiotics, and you don't see that. So my recommendation for a kid who's been diagnosed with PANS or PANDAS, like from a pediatrician, would be to medically take care of it. Get your antibiotics. That's a good. Please don't avoid antibiotics. But also take your child to an OCD specialty therapist. And they can help give you and the kid tools to get over the OCD, regardless of how much the antibiotics help.
So it can be latent. OCD can kind of be latent in a person, and then for whatever reason they lose coping mechanisms, or
I see OCD. Yeah, I see OCD as like a pattern sometimes. A brain's job is to ask a bunch of questions. Is this safe? Is this dirty? Does this cup have germs on it? Right. And if I start to take some of those questions too seriously, or I start to avoid something like a cup, that fear, I would just produce kind of a fear response. And the more I avoid, the more the fear would build and build and build and build, until at some point, there's just this breaking point where I'm not drinking water out of cups anymore, or something like that. So I think sometimes OCD is like almost a thinking pattern that we get into that works for a while until kind of hits a hitch. and gets caught in a loop and it doesn't work anymore. And then that's my job as a therapist. How do we straighten out that loop? Right.
Okay.
Mm-hmm.
So Jessica asks, how are the food preferences different than ASD, than autism food aversions or sensory food aversions?
Mm-hmm. That can be, oh boy, I could answer that question for an hour and a half. I'll try not to. OCD can come with a lot of different type of symptoms. So you might have a kid who has an intrusive thought about choking, let's say. So my obsession is I might choke, and the compulsion would be to not eat, or the compulsion would be to only drink smoothies, or the compulsion would be to not eat certain foods or something like that. So that wouldn't be a food aversion, right? That would be a fear. That would be a fear of choking. And then the treatment for that would be to have the kid start to eat and take a lot of risks. You might choke. I don't know. Sounds like your OCD is telling you what you can and you can't eat. It'd be really nice to eat pizza. Can we practice? Can we practice taking a bite of pizza and show the OCD that even though you might choke, A, you probably won't, and B, you get to eat what you want anyway. So you can get an intrusive thought like about choking or about being poisoned, and then you would see a food aversion from that. Or you might have this just right thing, like I was mentioning earlier, a kid who just doesn't feel right. I only feel right if I put on the right pair of shorts. I only feel right if I eat the right food. I only feel right if I do X, Y, and Z routine in the morning. So that might look a little more similar to some of the food aversions. And assuming there's not an ASD diagnosis, and depending, even if there is, you would again practice some kind of exposure therapy. And the way I would talk kids through it, I would say, let's see what it really feels like to feel not right. I wonder if we can feel not right and have fun. I wonder if we can do those things at the same time. Maybe eat some donuts or eat whatever it is that's not right, and then play a board game. Or I got video games in my office. I got board games. I got whatever we want. So there's always this little element of challenging, but it's important to understand why that there's the aversion.
Okay. Okay, I'm going to go a couple more questions. And for those of you who are watching, we're going to answer these next few questions on OCD, and then we're going to move into anxiety. So a couple questions about OCD in school, suggestions for working with a child with OCD, and can it be toggled on and off? And is it possible that a child would have these issues at home but not at school?
Yes. The answer to all that is yes. So for kids, I think it's very important if you have a kid with OCD that A, the kid understands that they have OCD and what that means. And then B, our job is to challenge the kid or challenge the OCD. And we're doing that because we love them and we think that they're super tough and we think they can beat OCD and go on and play and have fun and live normal lives. So as like an educational therapist, tutor, teacher, and any of those things, we wouldn't want to just force the kid to do stuff without telling them some rationale for why. This feels like your OCD, kind of telling you can't write or rewrite your letters or something. My job is to help you show yourself that you're super tough and you can do it anyway. So what do you think? Do you think we can do this task and this task together? And usually when you present it to a kid in that form, they're more likely to go jump in with you, practice with you, try with you. A lot of praise, a lot of effort. I really appreciate how hard you're working. Look at that. You're doing so great. So that would be something for like teachers and tutors and things to keep in mind. So talk with the parent, talk with the kid. When I work with kids, I'll try really hard to have a conversation with every school counselor and teacher so that the teachers know kind of where the boundaries are. Here's what we're working on. Here's what you can do. Here's what words you can use. And here's really what we shouldn't do. So that might be helpful for that. In terms of OCD being toggled on and off, oh, absolutely. And in terms of kids having no OCD at school and a lot of OCD at home, that makes a lot of sense. If I'm a kid, if I'm 10, the most important thing to me in the world is that my buddies think I'm cool and I don't seem weird in front of the other 10-year-olds. So at school, there's no way I'm washing my hands in extra time where somebody could see and point it out and I would get noticed for that. So a lot of times those kids will just like kind of white knuckle through the school day. And then they'll like hold on to their OCD, hold on, it'll build, and then it'll get home and they'll let it all out. And we'll do a big shower or a big prayer or a big whatever. So that's really common. And then in terms of what we would do about something like that, again, I would talk with the parents and the kid, and have some sort of plan. Is there a way we can challenge here? Is there a way we can challenge at home? As a teacher, how can I help? How can I help you challenge this? I think you're super tough. I think you're an awesome kid and you can do this, and I want to be here to help you. Kids will open up a lot more that way.
Okay. Marilyn says we skipped over it. Marilyn, but we just talked about what to do at school, so hopefully you caught that. And then one more, who is the best therapist to see for food aversion? I don't know if they mean like specifically like a name or the type of therapist for OCD.
Yeah, that's so I can answer a couple ways. In terms of finding an OCD provider, so a couple things. Anybody here, if you want, you can reach out to me. cbrandt@houstonocd.org is my email. And if you let me know where you're from, I have resources in a lot of places because I've had residents come from all over the country and the world. So we're pretty well connected to OCD providers and OCD providers that also are familiar with ASD and how those things can fit together. So that's one thing. You could reach out to me. You can also go on the International OCD Foundation website, iocdf.org. And the IOCDF has a Find a Therapist section. And those are all therapists who've had, training in OCD that would be able to point you in the right direction. And I see Jim wrote there, type of therapist.
Okay.
Type of therapist. If you're looking for OCD treatment, you need one treatment and one treatment only, and that's called exposure and response prevention, or ERP. So that's based in cognitive behavioral therapy, CBT. It's also kind of based in ACT, acceptance and commitment therapy. All of these are a lot of acronyms, but you need a therapist who knows ERP. My treatment day is probably 90 to 90%, 90 to 95% ERP. And if you reach out to a therapist for your kid and they say, oh yeah, I've done ERP before. Oh yeah, once a week, a couple times a week, I'll do ERP. I would just thank them for their time and find someone who does ERP full time. Because OCD can be very tricky and very squishy. And if you don't get somebody who really knows OCD and how it's going to try to weasel around on you, it'll get around you. And then you risk spending a lot of time and effort and money on treatment that isn't maximally effective. But you also don't want the kid to think, oh, well, I did treatment, it didn't work. It's never going to work for me. I'm broken. I'm different. Like I never want a kid to feel that way. So it's important to find the right therapist.
Okay. Well, great. Well, Cassandra's question is a nice segue into moving into anxiety, because she lists, she says you're also describing symptoms of ARFID, which I'm unfortunately very familiar with, anxiety, OCD, anxiety, ADHD, SPD, comorbidity, I can't say it. Comorbid conditions are often hard to separate.
They are.
So let's get into anxiety a little bit. And then so moving into that, how does a parent know when to seek help? Like when it's too much, or, when is hand washing too much, or when should they seek help?
Yeah. For any anxiety disorder, anxiety is the emotion we experience when we anticipate a threat. Fear is the emotion we experience when there's a real threat in our face. And both of those things are very real and normal and healthy. We should have some anxiety thinking about a test we have to take tomorrow, or getting in a car accident or paying our bills. Those things help keep us moving. So anxiety is not bad in and of itself. We should be encouraged to feel it and let ourselves feel it and work with it. Anxiety is a problem when it starts to get in the way. When I'm feeling enough anxiety, or maybe more accurately, I'm avoiding enough that I'm not doing my schoolwork, or I'm not interacting with my friends anymore, or something like that. In terms of the comorbidities, yeah, I mean, if you've got that many comorbidities, it's good to get in assessment from a therapist who specializes in this kind of thing. A lot of the things like your ARFID, your OCD, your anxiety disorders, depending on the kid, are treated similarly enough. Some type of exposure therapy, some type of desensitization therapy, where we have to practice feeling things we don't like feeling over and over and over until it gets a little bit easier. But there are differences in these disorders too. So it's probably the best answer I can give for something like that.
Okay.
I'm lost in my own answer there.
That's all right. So anxiety, how can you help? We have one child who gets anxious before bedtime. We have another who's doing some hair pulling and hair twirling. And another upset when things go wrong. The perfectionism.
Yeah, and I see the COVID concerns are coming up too, which I'm definitely seeing in my practice. So there's a couple things to do with this kind of kind of anxiety. Maybe I'll talk about coronavirus for a minute because it'll be similar to what I would say anyway. But during coronavirus, we're all on quarantine. Well, in Texas, we're really not as much anymore, but most of you are on quarantine. And everybody's schedule gets messed up. Kids really need structure. Kids really like structure, even though they push against it. It really helps them. It helps us as adults too. If you've got somebody who gets laid off in their job in the middle of their working career, there's so much data that would say if they set themselves a structure of waking up at the same time, getting some exercise, applying for jobs, or doing whatever, their mental health really doesn't change nearly as much as somebody who doesn't give themselves a structure. So a structure for kids is going to be really, really important. It helps keep them moving instead of getting stuck on their thoughts. Now, in terms of something like anxiety before bedtime, there's a way of handling sleep anxiety, where the theory is the harder you try to fall asleep, the harder you try to force yourself to sleep, the more awake you're going to get. And the harder you try to not fall asleep, the sleepier you're going to get. So I've had patients where I've told them before they're telling me they're not sleeping. And I'll just say, you know what? I need some more data. I need you to do something for me. Just go home tonight. And just whatever you do, try not to sleep. Like lay in your bed, do your normal bedtime routine, no Red Bulls. But just try not to fall asleep. Just enjoy your imagination for the whole night. And almost universally, the next day they'll all say, "Oh my goodness, this felt great. I slept fantastic." But then after 2 or 3 days, it'll stop working because they'll start trying to fall asleep by trying to not fall asleep, right? So normally anxiety will work that way. The harder we try to kind of run from it, the harder it'll chase us. And the harder we chase it, the faster it'll run away. So sometimes anxiety at bedtime would be about, yeah, I don't know if we're going to sleep. Let's just sit here and enjoy for a minute. Enjoy your imagination. Let's see what happens. And that might help. If a kid has running thoughts, so I see like the hair twirling, pulling, trichotillomania, excoriation disorder, when we're anxious, we'll twist or pick our skin or pull our hair. I like a game. I like to play a game sometimes with kids that I'll call Thank You Brain, where I'll say to the kid, you be you, and I'm going to be your brain, and I'm going to say a bunch of anxiety things. And no matter what I say, you can only say thank you. And that's the game we're going to play right now. And then I'll just sit there and go, oh no, I'm never going to fall asleep. What if I never fall asleep? What if I don't go to school tomorrow? What if I fail my test because I didn't sleep? What if everybody gets coronavirus? What if they're going to die? And if the kid just says thank you and we can give them enough thoughts like that, then I can just kind of trail off into, I wonder what's for dinner tomorrow. I really want pizza. No, I want ice cream. And at some point they can recognize, oh, look at that. If I have a thought and I just let the thought kind of go, the thought actually goes away. It's the act of trying to stop and figure out and fix every anxious thought that I have that is really, really important. So you could call that kind of a mindfulness exercise. You could call that self-awareness. But I think it's just practicing having anxious thoughts and letting them go. It's okay to have it, and it's okay to not jump into it and figure it out and let it go, even though that's hard. So the hair pulling and stuff is often an anxiety issue. That might be a way to help with that. If you need a therapist, a referral for the body-focused repetitive behavior, hair pulling, skin picking stuff. Oh goodness, there's a website, and I'm blanking. BFRB.com, I want to say. Body-focused repetitive behavior is the term for that. So there's another website that is a list of therapists across states that have gotten training in body-focused repetitive behaviors that could help with that. So if that's helpful, please reach out. And you can, if anybody again wants to email me, I think I see somebody asked for my contact info. C Brandt, as in Chad Brandt, at houstonocd.org. Again, I'm pretty well connected. I could probably help you find somebody.
And I will, I wrap this up and I put it on YouTube and I send it out to my email list and I post it on Facebook and it'll have your website, your email address, everything.
Perfect. Yeah. So you can always reach out to me, and hopefully I'm giving you a few other places you can reach out and look to as well. And I see somebody from Canada. My wife's Canadian. Hi, from
Canada. Okay, so I posted something in my own Facebook group the other day, and instantly it had 100 or 200 "Hey, me too" situations, and that is I have a child with anxiety and social anxiety, and he said he likes quarantine life better. Right? Of course they do, because there are no demands being put on them.
Yes.
And he says he likes it better. So, and like I said, instantly, like it had 100 or 200. Yeah, me too. Same here. So what can we do for those kids who, don't want to return to school and they prefer this homeschooling and they prefer being here? Like I said, there are no demands being put on them,
Yeah.
and they can finally like exhale,
Yeah, that's a really good question. I think we're going to run into a lot of that in the fall, assuming schools reopen in the fall. The anxiety is like, it's like your mind is like a balloon. And anxiety, your brain is kind of constantly filling it with anxiety. What if I fail? What if people judge me? What about this? What about that? Right? So this balloon is constantly filling, and it's up to us to put pressure on the outside by going to school anyway, by doing our project even though people might judge us, by touching the toilet even though we might get contaminated and die. And what's happening with the with quarantine is that the pressure is coming off on the outside, right? So the anxiety is filling everybody's balloon a little bit more, and then when we think about going back to school, it's getting that much harder. So I think this is something we will run into. In terms of what to do about it, I would practice a solid month before school starts. Get your kid out of the house. Go to, golly, it depends on what's open, but go to the mall or the museum, or set up play dates again with friends. Put them in positions that are maybe a little bit uncomfortable, but certainly doable and potentially fun. Anxiety hates fun. I like to have a lot of fun with my patients. So that might be something that would help you. Know that you're going to struggle. Know that they're not going to want to go back to school no matter what. But practicing some of the skills about having time pressure on you again, having social pressure on you again, and being able to have fun, succeed, thrive in those environments, I think would be really helpful.
Okay.
Mm-hmm.
Let's see. Andrea shared a story. Thank you. She says her child's in therapy now for OCD. Priscilla, daughter wants to drop out of school.
Yeah, I'm sorry to hear that.
Yeah.
Um, it depends on the age of the kid, but one thing that I think is helpful for everybody, kids and adults, is to check in with what we would say as therapists, like check in with your values. What are you doing that's important to you? Why are we doing school, right? So you might ask your daughter, well, what do you want to do, right? What do you want to do with your life? I want to be a veterinarian. I love animals, blah, blah, blah. Okay. Well, if you want to go be a veterinarian for 40 years and help 100 million animals and have a ton of fun and all that would be great, you've got to do this many more years of school, right? And I just wonder if it's worth it. Is it worth it to do this many years of school in order to have this whole many years of something that you would really like doing? Sometimes if you can touch in with like why we're doing things in a way that's meaningful to the kid, it's easy for us as adults to say, well, you need money, you need a job, you need to get out of my house. I know best. I'm the adult. You have to go to school because that's what the rules are. And those are all true, but to a kid that sometimes I think feels invalidating. And they're like, well, no, I'll be fine. I'm 15. I'll go get a job at Starbucks and own a mansion in a couple of years because I'm 15 and don't have a great concept of money. So giving them more of a reason might be helpful.
Okay.
That's helpful. And I have to, for Andrea shared a story, and I just have to say how much I love OCD. Because I've actually never heard that one before. I've heard so many things similar to it, but I've never heard that one before. And I love when I hear a new OCD thing. But I think it says a lot about OCD that it's a constantly spinning, twisting torrent of thoughts that are never
Right.
exactly the same, but you handle them the same anyway.
Um. Okay. So speaking of school again, what treatments or strategies have you found successful in dealing with school refusal as related to anxiety?
Yes, school refusal is
Fun, isn't it?
it's
And it's
tough.
on the uprise. It is. I'm
It's going
I'm
to be too.
yeah. I mean, I'm dealing with so much more than I like 10 years ago. I didn't even think I ever heard of it, and
Mhm.
now it's everywhere.
Yes. So I think school refusal is a mixture of a couple of things. You've got the psychological component underneath that you have to help the kid with. Are you anxious? How can I help you feel less anxious, right? Are you depressed? How can we help you deal with the feelings of depression? Do you have OCD? How can we do therapy to get rid of the OCD? So that's always the first thing. I think. I think with kids, how do we help? With that being said, sometimes I'll get a kid who's already refusing school, and we don't have the time to do a month or two of anxiety therapy while they miss school. So you've got understanding what's going on in here, understanding the psychological issue, and then it's a lot of consistencies, a lot of consistent boundaries, consistent rewards, consistent consequences. Depending on the age of the kid. If you go to school, this happens. If you don't go to school, this happens. We're not having a big fight about it. I'm not getting in a 2-hour argument with you about it, but this is what's going to happen. And remaining consistent. And that doesn't have to come in the form of a threat. It says, I love you. School is something we have to do. I also have 2 other kids, and I cannot argue with you 2 hours a day. So this is now your decision. You're 14. This is your decision, but these are the consequences either way. So putting out something consistent, and then the hard part is staying consistent as the parent. But usually some consistent boundaries on either end, and helping them understand what their anxieties or whatever, but a lot of times anxiety is underpinning the school refusal, and helping them with that will get them moving. But it can be a slog.
Right. So what if, and this is, I think this is going to get worse too, as you know, we're headed for some real financial woes, I think, as a country. A lot of times, I think the child's fears, or whatever you want to call them, issues at school are very much justified, in that their learning needs are not being supported, their sensory needs are not being supported, and that's causing the anxiety.
Mm-hmm.
Okay.
I think that's absolutely the truth. It's hard to do at home.
Yeah. Noelle, her daughter is afraid that buildings will fall on her.
Oh. um. Uh. So you can. I would handle this 2 ways. If this is like and I see Down syndrome and ASD. Okay, I didn't see Down syndrome, so I'm going to change my answer before I give it.
No, it is Down syndrome. Yeah, it's
Yeah,
Down
yeah.
syndrome
Okay,
and
okay.
ASD. Mm-hmm.
This is something that I would deal with a lot of reassurance and just slow, gradual introducing to concepts. So we might stand a safe distance away from a 2-story building, a distance that gives your daughter an anxiety level of 5 out of 10. I'm kind of making this up. I don't like to give numbers on anxiety usually, but something where, okay, we're getting close to the building. You're getting a little nervous. We're also safe. So let's practice being uncomfortable and hanging out and having fun. That's a lot of what I would say. What can we do kind of near a building? We're safe, but you're uncomfortable. But look at you. You're so tough. I'm so proud of you. Blah, 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 blah. Let's have some fun. And as you do that over time, you can slowly get closer and closer and closer to one building, and then you can start doing it with bigger buildings. But it comes with a lot of support and reinforcement if we've got like Down syndrome and ASD. If you've got a kid that's neurotypical who's having the same concerns, I would put a lot more uncertainty into my treatment. And I would say, we can never really know. We can never really know if a building is going to collapse at any point. But we have this whole fun life that's there for you around buildings. So I wonder if we could go around these buildings, have some fun, do some stuff, knowing that there's a 0.2% chance you would die, but like a 99.8% chance you'd have a ton of fun. And I don't know, what do you think? Is it worth it? And sometimes they'll go with you on that. But I think as parents, sometimes we get in a habit of trying to reassure too often. It's fine, it's fine, it's fine. And then the kid says, how do you know it's fine? And like, you can't with perfect certainty say a building won't fall over or a car won't crash or something. So sometimes we help them into and live with uncertainty. So that might be kind of 2 ways to handle that.
Okay. I'm how do you make sure that a behavior plan doesn't reinforce a ritual?
Yes, it's a good question. There's always a why. There's always a reason that the OCD is attacking a kid in particular. So let's say there's a perfectionism thing. This might be like a perfectionism OCD case. I need to be perfect. If I'm imperfect, nobody will like me. If I'm imperfect, I'm gonna die. Somebody's gonna die. Something terrible is gonna happen, right? And so what we're aiming to do is be imperfect. Yes, sure, but really we're aiming to kind of take the risk. We're aiming to challenge the OCD. Can you challenge the OCD and dare the OCD to kill you by being imperfect, right? And if you keep that underlying concept in mind, it's easy, I think, to keep from falling in the OCD traps. But if you just outline like a procedure over and over, well, like step 1 is do something imperfectly, and then just do your homework imperfectly, do this imperfectly, do that imperfectly. Then the kids will find a way to be perfectly imperfect, or they'll try to be imperfect but still keep everybody alive. So they'll work around you, right? So understanding the why is really, really important with OCD. So I don't know if that's helpful. Reach out to me if you want, but Yeah,
Yeah.
it's tough, and I think that's where you need an OCD specialty therapist for something like this. It's because it gets tricky.
Yeah.
Never.
Edlira, I'm going to skip over your question only because you said your daughter is 20 months old, and I think that at 20 months, you
It's
know,
parse apart. A lot of it's normal.
yeah,
Yeah.
yeah,
A lot of this behavior I'm talking about is normal for a 2-year-old or a 4-year-old. It's hard to differentiate. That's right.
yeah, and mouthing toys, at 20 months isn't necessarily abnormal behavior. But we have a couple questions about perfectionism and crippling perfectionism that prevents, things from getting done. Things are not getting assignments not getting on time. Tests can't be completed.
Yes. Um, you're probably going to hear me say the same stuff a couple of times now, but why? Why does it have to be perfect? That would be something I would want to understand as a therapist, and then I would just want to dare that negative belief to come true, um, and see what happens. So maybe I could use like a contamination example just for the sake of argument. But if somebody had like terrible cup OCD, I'm afraid I might get cancer from the cup, right, or whatever. Typical exposure therapy would be like, okay, get close to the cup, look at a picture of the cup, do this to the cup, right? And you can do OCD therapy that way, but it's a long slog. It takes a long time. Sometimes I like to say, well, if you're ready and if you're willing, let's just try to get cancer from the cup, right? It's kind of silly. It's kind of ridiculous. Let's just try. And if you get cancer from the cup, well, I'm sorry. You know where to send the lawsuit. But if you don't get cancer from the cup, maybe we can just move on from the OCD, right? So I think if we think about that with like a perfectionism thing too, sometimes it comes down to, well, what is the bad thing that could happen, and let's try to make it happening. Try to make it happen. Right now, you're telling me every school assignment has to be perfect, or you're going to fail. And paradoxically, we're failing because we're not turning anything in. So let's try it this other way. And sometimes that's helpful. Sometimes that breaks them out of the logjam. I never argue with a kid or an adult with OCD or an anxiety. I'm not going to convince you. You're not going to convince me, and I'm not going to convince you that Mrs. Smith is a really hard grader and this problem needs 2 hours of work. We're never going to get to each other. And sometimes it's easier to say, well, maybe she is. I don't know. Could we try? Could we try doing 1 minute of work instead of 100 minutes of work and see what happens? I don't know. And then sometimes you can get them moving more quickly other than that. But OCD loves a prolonged argument with a parent. So that's
which
parent training.
which is great. That is a great segue into Dana's question, which is what advice do you have for parents who are experiencing stress from their child?
Oh yeah, so go find somebody to talk to. Take some time off. Take some time off from yourself, from the OCD, from the kid.
Yeah. And if we can't,
Yeah, and
if
if
we
you
can't,
can't during quarantine,
prepare
yes.
to get quarantined.
Yes. One thing I tell parents a lot of times is OCD just wants to be fed. It's like a pigeon at a restaurant. If you've got this, if you're at an outdoor restaurant, the pigeon comes up and you throw out a French fry. It might take the French fry away for a minute, but it's going to eat it, and it's going to want another one. It's going to come back, and it's going to come back, and it's going to bring his friends, and there's going to be a bunch of pigeons around you before you even know it. So the trick with OCD is not to give it even one French fry. And the big arguments are French fries, and the big discussions are French fries, and the big philosophical discussions are French fries. So I'll tell parents sometimes it's okay to say, Finley is my son. Finley, it's okay, dude. I'm so sorry that you're struggling right now, and I get that, whatever OCD thing is happening, I get that it's really stressing you out, but I love you. I really hate your OCD. I don't want to talk with your OCD. I'm gonna go in the other room, and when you're ready, I will talk with you about anything in the universe besides this OCD concern we're stuck on right now, because I love you. But until then, I'm just gonna let you work it out, and I'm gonna be over here, and we'll come together when we're ready. And sometimes just the separation, right? A is fueling for the parent. You get some time to yourself, and B, the kid has to work through the problem a little bit on their own, which is usually helpful, and come up with a solution. And then you guys can come together and talk about something fun, or depending on the age of the kid, do a craft or some homework or something. And then you have some nice interactions with each other again, which is really helpful.
Okay, before I want to get into some EF issues, I just want to let you know, those who have asked, that we're not going to be making any medication or supplement recommendations today. That's not appropriate to do on Facebook, not having met you or can't even see you. or your child. But Nicole says, can a lack of executive functioning skills contribute to anxiety? I would say that's definitely yes.
Yeah, yeah, absolutely. And then you might look at like, okay, is this an ADHD thing with the lack of executive functioning skills, or is this like a ASD thing, or where the cognitive or executive functioning skills lack? Where's that coming from in terms of treatment? But the answer is absolutely yes. If it's hard to think through our problems, if it's hard to catch and think through our feelings, or understand what we're thinking and feeling in any moment, it's really easy to get overwhelmed. And when we're overwhelmed, we make poor choices, we avoid, we get angry, and that usually starts a cycle that'll end up somewhere bad, somewhere unwanted. So that can absolutely be the case. And I don't have a great resource for that off the top of my head. But I know there are executive functioning like coaches, and a lot of therapists have that training.
And actually, I did not plan this. But I think next Wednesday, my Facebook live chat, I believe, is the executive functioning person. She's an executive functioning coach. If not, I mean, watch the Facebook page or make sure you're on my email, and you'll know for sure. But I think it's next Wednesday at 10.
That'd be great.
Because another huge issue for our kids. Okay. Can you just quickly address, it looks like maybe we had some latecomers to the talk, but can you do another maybe 2 or 3 minutes on PANS and Pandas?
Yeah.
And kind of explain, because I don't want to offend anyone who's watching right now. I feel like PANS and Pandas is being used as a crutch now. I don't know. I feel like it's I feel like it's like almost like a carrot maybe being dangled, that your child has these issues and everyone says, oh, it's PANS, and then take antibiotics and all your worries go away, kind of thing.
I think anything that comes up, not to say that Pandas just like came up in the last 5 years or whatever, but anything that comes up, generally people really want to latch onto and grab onto and get to be a part of. So I think there's maybe some overdiagnosis of it. I have no numbers for that. And I think too, it's really, really, if my son was struggling, my son was taking a 10-hour shower every day, and somebody told me I had a medication that could get rid of it.
Right.
Golly, you don't say anything. I would just get everybody out of my way, right? And I would give that to him. So I think there's a really strong pull into wanting that to be the answer. And sometimes it is. Sometimes that seems to help kids a lot. Sometimes kids get the medication, the OCD symptoms go away, life is good, and that's great. But sometimes it doesn't, right? There's some kids that get the antibiotics and it doesn't show the improvement that they would want. And so it'd be for those kids. And I said this earlier, and in case everybody missed it, take care of things medically. Go to the pediatrician, right? Follow your doctor's advice. If they say, let's try antibiotics, please, please, please try it. Do not say that I said not to take antibiotics. But if the antibiotics aren't giving you the relief that you want, there's therapy that can help with that too. And you can find a therapist that might be able to do this work, or do it in conjunction. I've got a number of psychiatrists I work with. I've got a number of kids that are on the antibiotics and doing behavior therapy with me that are getting a lot better.
I mean, I know you're not a pediatrician. Does PANS or Pandas have a definitive test, or is it one of those kind of rule out things where it's a menu of items, and if you check a lot of the boxes, you can,
man, I at the risk of talking outside of my area of competence, you can test for a lot of things, but there's a number of different antibiotics and antibodies and viruses that you can test for. As far as I know, there's not like, well, this one is PANS.
Okay.
More like this, we have some data, and this is what it would suggest. And then you begin the treatment and you see if it helps. And then again, if the treatment helps, fantastic. Please take it. And if not, there's behavioral therapy too.
Yeah. Okay. Okay. More PANS questions. So I think that might be it. It looks like the rest was more PANS. Oh, Caroline says, what about inflammatory issues or diet?
Yeah, there's not a lot of great data that would say that diet has any impact. There's no data. There's very, very little data that would say anything definitive about any supplements or anything like that. OCD, anxiety can be exacerbated by a medical condition, but regardless of whether or not the condition is there, we still have coping mechanisms we should be using, skills we should be using. So I think it'd still be helpful to find a therapist either way, or a professional that could help with that.
Okay. Oh, one more from Amy. She has a little hoarder on her hands already. An 8-year-old hoarder.
Oh, carrying a bag of stuffed animals. Okay. I have a lot of suggestions, Amy. Hoarding is really interesting. So you've got OCD, which is a fear reaction, and in the last professional manual that Psychology as a Science put out, they pulled hoarding separate from OCD. And one of the reasons for that is hoarding tends to come with a grief reaction, like a sadness. I'm losing something kind of reaction. So I would be curious for your daughter. Is it more of a fear? I'm going to lose something. I'm going to lose my childhood. I'm gonna be a different person if I give these things away. That would be more of an OCD concern versus this just feels like a part of me and I'm very sad to be losing it. So that's kind of one question that I would just naturally have. But as for suggestions, A, find an OCD specialty therapist. B, start to take some small steps and explain to her why you're taking them. So this feels like a lot. I'm so sorry you're carrying around this big bag and it looks so heavy. And over here I've got cookies or a board game or something, but it's hard to play it when your hands are full of this bag. So I wonder if we could start putting down the bag for a couple minutes in order to play and have fun. And then if you can get them moving sometimes with that, then you can point out, oh, look at that. Oh, you put the bag. Oh, good for you. How cool is that? I wonder if the bag could be a little farther. I wonder if it could be a little more empty. I wonder if this. I wonder if that. So you're allowing them to be uncomfortable. You're putting the discomfort in front of them. You're not forcing it on them. I'm taking it away right now so you can learn. That's just a meltdown that will kind of work in the long term, but it'll be a lot of meltdowns. It's just an opportunity to see, and a lot of praise, a lot of, oh, look how great you are, look how strong you are, I'm so proud of you. That kind of stuff goes a long way.
Okay. Kate, if you want to scroll back when we're finished, we talked about falling asleep and anxiety, probably about halfway through. So maybe around the 20 or 30-minute mark, you might want to take a look there. Do you have any comments about neurofeedback therapy for anxiety?
It's new. The data tends to be mixed. The data doesn't seem to be as good as finding a good OCD or an anxiety therapist. Somebody else would probably argue with me on that, but I know it's one of the new things that people are trying. So I tend to think we've got a really good anxiety and OCD is a set of things that we have a lot of really good therapeutic tools for. So neurofeedback might be one of those tools. It's hard for me to say, but I know we have a lot of good ones as therapists too.
Right. Yeah, and I am, always on the site. I feel responsible to only recommend things that, have a significant amount of data behind them, because it would be irresponsible. None of us has unlimited budgets. So, these are decisions you have to make, and maybe a few hundred or a few $1,000s, maybe your family can afford that, and it's worth, it's risk, it's cost.
Absolutely, and I think being informed is
Yeah.
helpful, and that's where I can say, if you're trying to find a therapist, at least a good question to ask is what percentage of your practice is OCD? What percentage of your practice is anxiety? How many of these cases do you have in a given week? And again, if you get somebody who says, oh yeah, I do everything, I do this, I do that, I would just really hesitate. Not that those therapists aren't good, helpful human beings for some things, but anxiety, OCD in particular, really needs a specialty therapist. So that might be a question to help find a resource that's helpful.
What do you, and this isn't a question from a reader, what do you say, or what is your opinion on, here we are in 2020 and we just have so many more kids with anxiety, and I'm not trying to be old school and say, oh, suck it up, kid, buckle up, buttercup, and deal with it. I'm not saying that. I'm just saying that I just know that when I was in school, were kids just masking it better and it didn't exist? Or are there environmental factors, or is it societal factors? Like, why is there so much more childhood anxiety these days?
Yeah, it's a good question. I think there's more pressure on kids today. I mean, to get into middle schools and high schools, there's pressure and the standardized testing pressure and stuff that even 20, 30 years ago, whenever I was in school, I didn't feel. So I think there's more societal pressure. And I think there's been a really big focus in school systems and in our society generally about helping kids and helping them understand their emotions and work through them. And that's a really, really good thing. But with something like anxiety and OCD, the treatment really a lot of times boils down to, let's do the hard thing. I would say lean into the anxiety is something we say a lot. And I think sometimes the message gets lost, and it goes from lean into the anxiety and get better to like, oh, let's cope, let's protect, let's hold back from. And I just wonder if that's a little piece of it. And I know your site is about IEPs in particular. And I put something on my website about IEPs this morning, knowing we were doing this. But I hesitate. I hesitate really hard to write an IEP for a kid with OCD or anxiety. And if I, because now we're accommodating the OCD. And when you accommodate OCD, when you accommodate anxiety, you feed it, right? So if I ever do an IEP, and I do IEPs, I'll always time limit them. And I'll tell the kid, we'll talk to the school about this for a month, so you can make sure and get your schoolwork done. But during that month, these are the steps that we need to be taking, so that we can take that accommodation away. And it's not about removing an accommodation from you. It's about you being able to handle it on your own because you're super tough and smart and, kind of whatever the language is appropriate for the kid. So I think it's just a natural shifting. Society used to say, suck it up. And we knew that wasn't helpful. And we've shifted off over here somewhere. And we just have to find that zone of it's okay to have your feelings. And sometimes we got to face them.
That's an interesting approach. Do you do independent evals for kids for IEPs? Or not too much?
Really. I'll do them for my patients as I see
Yeah.
fit. But we have an evaluation service in Houston. I'll send them out too.
Gotcha. Yeah. I was just asking. All right. One last question, and then we'll wrap it up because it's almost 2:00. Do you feel art therapy is worthwhile?
It's a good question, and the answer is going to be it depends.
Right.
So I'll address OCD first. OCD, if you or a child or a family, if anybody has OCD, find a specialist. And a specialist is going to do ERP and only ERP, and that's what you need, and you don't need anything different. For a young kid in particular, or just kind of a generalized anxiety and worry problem, sometimes in art therapy, a play therapy can be a good way for the kids to open up. And then when they open up, you can have a conversation about facing anxiety and being tough. So the core of like face your anxiety is still in there. So I think it depends how you use the art therapy or the music therapy or the play therapy or things like that. With OCD and anxiety, it's nice to talk. It's nice to have somebody to bounce ideas off of, but you should really be getting challenges. You should be really getting things you can do to feel better, right? At the risk of sounding like super rigid, as a therapist, like these are the things I'll tell people when they first come to see me. My job is to help you feel better and for you to never come back and see me again, right? And that'll make me very sad when I don't see you again because you seem cool, but also you have a life to live. So I think it depends on how you're using it. And I see one person commenting a lot of times about needing an OCD specialist, so I appreciate that feedback too. And,
Yeah.
and if I can plug something for a second.
Yep. Oh, absolutely.
Wrap up. One of the things, so at our clinic in Houston, one of the things that we've started doing is offering like intensive one-to-one services, primarily for adults. We'll do it with some teenagers too, depending on the case, where I might work with somebody like 2, 3, 5 more hours in a day for maybe a week or two, or even just a couple of days. And that type of treatment seems to be really, really effective for OCD and anxiety, and break up the systems a lot faster than it is to come in once a week for a couple of months. So there's a lot of data coming out that says that this type of treatment for OCD and anxiety is really helpful. So that's what we're doing in Houston. If anybody has any questions, you can reach out to me, or I can point you in a direction wherever you're from. I saw somebody from the UK up earlier, and I know there's like just a empty glut of service, a big hole of OCD services in Europe. So I hope you reach out to me and we figure something out. But sometimes it's helpful to just clear your schedule, focus on the anxiety or the OCD, really get your skills in turn, and then go back to school or go back to work and try them out. So that's just something we're doing that if anybody wants to talk about, I'd be happy to.
Mirjana is from Azerbaijan.
I don't know of anybody out in Azerbaijan, but yes, I mean, but this is we can there's laws and regulations across states and countries, and we'll help you figure out some way to get some relief, because you deserve it. It's important.
Yep. All right. Well, thanks. I mean, I learned a lot. Thank you so much for being here. I think everybody else did too. For those of you watching, or if you're tuning in late and you didn't get a chance to watch, this will be, it will live in infamy on the Facebook page forever. And I also will get it posted to YouTube, and I send it out in an email, and I'll put it on the blog and everything else. So I also transcribe it for hearing impaired readers. So so that's it. Thank you so much.
Thank you so much for having me, and thank you everybody for participating.